Good afternoon, everyone. It's Terry Walsh, the CEO of Friendship Villages. Happy to see you at Chesterfield and Sunset Hills on this Wednesday, June 24th. This is our weekly update. I'm glad to be with you today to talk to you about some of the things that have been going on in the villages. First, our COVID-19 update. You may or may not know that literally as of today, we're back to zero again in the terms of the number of residents on the campus at any level of care who are positive for COVID-19. We were positive once before, as you know, and then through blanket testing through the state blanket testing program for COVID-19, we found a couple of residents in the care center in Chesterfield who tested positive. They didn't have any symptoms, but tested positive for COVID-19. And they're all back to normal now. They never had any symptoms anyway, but they did their time. We observed them for 10 to 14 days, depending on which one it was, and they're back in the normal population. So on Chesterfield, there are no residents at this point, again, who have COVID-19. At Sunset Hills, we did get a patient or a resident from the hospital directly who had tested negative twice before leaving the hospital, but arrived on our campus in the Village Care Center testing with a small or a slight fever, so we had them tested again once they got here, and they tested positive for COVID-19. So they've been quarantined for quite a time now, and as of today, by the time you're watching this video, they will have graduated also from quarantine in the care center. They've never really had any symptoms. The mild temperature that they had went away after a day or so, and they haven't had any symptoms since, and they're doing very well. So we're back to zero again today. We'll knock on wood that that's the case and count our blessings that those didn't spread. We didn't have any particular issues with those residents. They never had symptoms, and we're back to normal. We are continuing blanket testing for residents in the care centers and staff in the care centers periodically. So each week, virtually, one of the care centers is going through complete testing, and then the alternating weeks, the other care centers going through COVID-19 testing, just to make sure and keep track of what we have going on, to make sure that nothing's happening. And so far, so good. Everything seems to be working well. Our staff now is conditioned to do the quarantining and the isolating and the caring for people who may have signs or symptoms or test positive for COVID-19. So I dare say it's kind of now become a routine thing that our staff is ready to react to when the time comes, if the time comes, that a resident might show positive for COVID-19. And that's a good thing. So we've learned a lot of things in this process. We still have no residents and have had no residents in independent living with COVID-19 or in assisted living with COVID-19. We're very happy with that. The good Lord has blessed us to have that condition. So we are beginning to open back up to Medicare Part A work and rehabilitation work in our care centers for residents who are going to the hospitals and beginning to have some of those procedures that require follow-on rehabilitation care in our care centers. We are restricted, though, when a resident comes out of the hospital after having a procedure. It is now protocol, at least for now, during COVID-19, it's protocol to isolate that new resident in a room by themselves for a period of time until we're sure that they don't have COVID-19. So even though we have semi-private rooms that are normally 2 people to a room, when we receive a new resident or even one of our existing residents who are coming back from the hospital for rehab in one of our care centers, they have to be in a room by themselves until we know that they don't have COVID-19. So that is artificially impacting our capacity, our bed capacity in the care centers, so that we can't fill all the way back up the way we were before COVID-19 started, because we have to keep that other bed in that room empty until we know that that resident doesn't have COVID-19. So that depresses our census a little bit in our revenues a little bit. We're adjusting for that. But just to let you know, we will probably, it'll be a while before we're filled up 100% again, because we do have to leave those beds open, the second bed open in some of those rooms as we get a new resident from the hospital. In Chesterfield, for example, we have lost some staff during COVID-19 who've decided to depart the organization on their own. And so we are a little bit short-staffed right now in the Chesterfield Care Center, in the Village Care Center, because of those staffing shortages. So right now we're unable, or we don't have the capacity at the moment, to increase the census in the care center right now until we get some more staff on hand. In fact, we just had a meeting, and we know that we are in need of 15 more employees in the care center in Chesterfield in order to be able to fill all the way back up to the 90 residents that we would normally have space for in the care center in Chesterfield. And that's 15 more employees of every flavor of registered nurse, RN, or LPN, or nursing assistant, or certified medical technician. So all of those levels of nursing care in the care center in Chesterfield we need. Some number of some or the other, but we need a total of 15 more people in order to bring the care center in Chesterfield all the way back up to full strength. So we're working on that, by the way. If you have any friends or relatives in the nursing profession at any of those levels of care, CNA, CMT, LPN, RN, let us know, because we're ready and anxious to bring them on board and have them join the Friendship Village family. So we would love to have your help in doing that. We seem to be okay on the Sunset Hills campus. We always are recruiting staff all the time anyway, because there's a natural turnover. But again, anybody who knows anyone in the nursing profession at any of those levels, please make that referral to us if you know anyone. And we know that the health systems in town have laid off or furloughed thousands of nurses of every type over the last couple of months due to COVID-19. So we know that there are nurses out there. We're having trouble finding them. If you know of any, please refer them to us, or have them call us, or get on our website, send us their name, and we'll be happy to get a hold of them and try to bring them on board. We have a growing business. We're blessed to have a growing business here, but obviously we need the staff to be able to do that. And nursing staff at this moment in time is hard to come by. So if you can help us, we would appreciate doing that. Over the next several days, you will be receiving a resident satisfaction survey. And you'll either get those mailed to you, or you'll be picking them up at one of the desks on campus, either campus, Chesterfield or Sunset Hills. You will receive a notice when those are available. And we encourage you to pick those up and fill those out honestly, and with your best assessment of how we're doing and how we're taking care of you. I'm hoping that they're all good. We've done a lot of things now to take care of everybody and try to keep everybody protected from COVID-19. We've done a decent job of that. We've made a lot of accommodations that are not the normal Friendship Village way, with delivering meals to everyone's apartments and villas instead of having everybody gather for social time in the dining rooms. And, some of those other activities where we weren't able to have large gatherings. And so I hope you take that into consideration when you fill out your satisfaction surveys. Things are not normal. We're not fully back to normal, but I encourage you to please participate in the resident satisfaction survey. You will be instructed as to how to pick them up and how to turn them back in. The greater participation we can get, the better, but we encourage you to do that. And then while you're thinking about the changes and the alterations we've had to make in how we do things during COVID-19, but I encourage you to do that. We are getting some questions from some residents about the United States Census, and you are encouraged to fill those out. If you haven't received a census form in the mail already, you should be. You may have received an email from the census, and I know that you can fill it out either way. I did that at home. I filled it out online for my family, and so there are many ways that you can return your census information, but I encourage you to do that. Remember that when you do fill that out, when you get to the question about whether you rent or own your own home, for residents of Friendship Village, you should mark it as a rent versus own on your home question when they ask that question. But otherwise, I encourage you to fill those out if you have not received notification. I know that you will soon. They may have split it up by alphabet, so you may or may not have received it yet. But I do know that the Census Bureau is attempting to contact people 6 different times to make sure that you've had plenty of opportunities to know that the census is happening and that you should be receiving that. We do not have control over the U.S. Census. We don't have any way to get you a census form, but we would just ask that you pay attention to your mail or your emails and fill out those forms when you get them. As you are obviously well aware now, we have now kind of reduced or lightened up on the visitor policy, particularly for independent living. So as of noon this past Monday, you know that you can have visitors now on campus, and I know a lot of you are very, very excited about that. Some of you who are brand new residents on the campus have never been able to show your family your new apartment. And so this is a great opportunity for you to be able to do that, and I hope you take advantage of that. You know that all visitors to the campus, just like employees on the campus, have to check in through the main points of entrance into the buildings. In Chesterfield, that's your new clubhouse entrance, which is gorgeous, by the way. I hope you've seen it. In Sunset Hills, that's one of 2 entrances. That's either the clubhouse entrance or the crossing entrance, where there is stationed during the day a screener who's sitting there with a nice smile on their face, ready to take your temperature and identify your questions, your answers to your questions about your potential exposure to COVID-19, to make sure you use some hand sanitizer when you come in or your visitors come in, just to make sure that we're doing all we can to try to keep the COVID-19 coronavirus off the campus. So we're asking all visitors, and just like our staff have been doing for 3 months, to go through all those protocols when they come to visit. And then, of course, to do the best they can to maintain social distancing and their no contact rule when they're visiting you. Now, I know that's really hard to do in an apartment, but certainly in the common areas and so on, we really are encouraging people to keep their social distancing, keep the mask on. It has to be a close-fitting mask. It can't be a bandana that flaps around. It can't be a handkerchief hanging over your face. It has to be a close-fitting mask. And so, but we do encourage you to bring your families over and let them see where you live. And some of them used to come all the time before the COVID-19 episode began, and some of them have not been here at all, and we encourage you to take advantage of that. You also know that our pools are open now to a limited degree for residents only, not for guests. So I hope you're able to take advantage of a little bit of exercise in the pool. Check with the concierge on how you sign up for the pools on either campus, just to make sure that we don't have too many people crowding the pool at the same time, because we know that while the chlorinated water is not known to spread the coronavirus, we know that all of the surfaces around the pool can hang on to that virus and spread through contact with those surfaces. That is our biggest concern. That's why we limit the exposure in the pool areas, and we limit the number of residents that can be in there at one time. So we ask for your continued cooperation, but we do welcome you to use the pools. A lot of you have been anxious to get back in there and get some exercise, and we encourage you to do that. The weather's been beautiful. We've had some great events. I know a lot of you have had outdoor visitors. A lot of you have been going out and doing all of those personal errands that you've been wanting to do since COVID-19 started back in March. And I know a lot of people are getting their hair cut now, and all that's good to see. We encourage you to do all those things, but whatever you do, and when you go visit your families or you go out on your errands, please continue to maintain the protocols that we've all learned and we've been living by for 3 months now, and that is to wear your mask, use hand sanitizer frequently, don't make contact with anybody, maintain the social distancing, and we should be okay. Now, we're still taking a risk because sometimes we don't know where we've just been or who we've just been around and what they've got or may have carried with them. So we still have to be very careful. We don't want to bring that virus on the campuses at all, because then we've got a problem with it spreading. And so we all have to be vigilant. I know we go out and we go into public venues, we go to grocery stores, and we go to places where we see a lot of people milling around and not wearing a mask. It bothers me personally when I do that. When I go to the grocery store and I see a lot of people walking around without a mask, it really bothers me when I see that. I wear a mask everywhere I go, and it bothers me when I see people not doing that. And it's putting me at risk, it's putting them at risk, it's putting everybody at risk. And then wherever you happen to go after that, you're putting everybody at risk in that path beyond you at risk also. And we don't want to do that. So I would ask you to be very careful, be mindful of your surroundings, maintain awareness of your situation, and try to do the very best you can to avoid contracting the COVID-19 coronavirus. We're very close to the end of the fiscal year right now, and I reported last week that we're doing well financially. We're going to have a good, strong finish to the fiscal year. I will also say that we're going to have a belt tightening year in our next fiscal year, which begins on July 1st. So we know that in our 5-year-long expansion project, there are some startup costs and things that happen as we get ready to open new buildings. Both campuses are going to be opening new care centers over the course of the next 6 months. And in Chesterfield, brand new assisted living building, by the way. Both of those buildings are absolutely fantastic, state-of-the-art, gorgeous facilities, and we can't wait to show them to you right before we open them to the public. We'll give tours and walk everybody through and let you see them when they're ready to go. And they're wonderful buildings, but there's a startup cost involved with getting all the staff in place and trained and ready to go, and everybody standing tall and looking good before the first paying customer can walk in the door, as you would expect. So it's going to be tight in the next fiscal year as we try to minimize the impact of those startup costs before we begin paying for it with the new revenue and the fees that come in with those new residents, new patients, and so on. So it's going to be a little tight next year. The budget is about to be approved by the board of directors. Resident members and observers of the boards are involved in that process. Mary Munganast in Chesterfield and George Buchard in Sunset Hills are your resident members of your village boards and observers of the overall company or corporation board at FV Services. So they are involved in that process and do have input and the ability to observe and understand and ask questions. So that is happening. And perhaps by the time you see this video, the budget will be approved. And we hope that that happens. So after that, we'll be able to share with you what is approved and what may or may not be able to be afforded in the next fiscal year, depending on what the board ultimately approves. I don't have the ability to tell you what that is yet because it hasn't been approved yet. But by the time that you see this video, or certainly by the next time I'm able to speak with you, we will have the answer to that question, and then we'll be able to share with you what can be done and what may not be done as we tighten our belts for next fiscal year and maybe wait out on some of these projects until the following fiscal year, a year from now. But that's all happening. I know that our staff is very excited about your being able to have visitors in-house. They're doing the best they can to keep everything clean and sanitized and to try to keep everybody safe. Once in a while, we have an employee come up positive for COVID-19. They are very good and conditioned to tell us if they think they've been in a risky situation, even by accident, and at which point we quarantine them at home and they don't come back to work. But there's always a risk, and we know that whenever somebody goes off campus, there's a risk out there, and that risk will continue to persist for quite some time. As you know, a lot of states in the United States are seeing spikes and increases in COVID-19. Missouri is no exception. Friendship Village is an exception, but we want to keep it that way. We've not had a spike here. We don't want to have a spike here. We don't want it on the campus at all. And that takes all of us and the efforts of everybody within the sound of my voice right now to try to keep that off of our campus and keep it away from you. That's my main goal, is to keep it away from you as the residents of Friendship Village. And I hope that you will help us by cooperating and understanding our protocols and helping us to follow those. I hope everybody had a good Father's Day for you fathers out there. I know we've had some different events on the different campuses. The campus at Chesterfield is really looking nice. The new clubhouse building, the new library is fantastic. I can't believe you're already out of space for books, and we're working on that. You had more books than anybody thought you had, so we're working on that, but the clubhouse is fantastic. I know that the ice cream parlor is open in Chesterfield, and life is really beginning to pick up steam in Chesterfield, and that's very exciting to see. That's why we did this project, so that your amenities and your lifestyle on the Chesterfield campus as well as the Sunset Hills campus would take a step forward. We've been working on some issues at the Sunset Hills campus as well. The Crossing lobby. The Crossing is the original building at Sunset Hills. It's about 42 years old. We just finished completely updating and renovating the whole lobby at the Crossing. It's fantastic. It looks wonderful. There's a nice fireplace. The carpet's new. All the surfaces are new. The furniture. It's still 42 years old, but it looks really nice now, and we hope that you're able to enjoy that in the Crossing. We're all still watching and waiting for landscaping to be finished. At Sunset Hills, we have the interminable water feature. Everybody's waiting to be completed between the buildings at Sunset Hills, which is going to be fantastic when it's done, and we're all holding our breath waiting for that to get finished. But it should be soon, and then there'll be sod going in all around. Chesterfield's looking good. There's one tiny thin layer of asphalt that still has to go in around the new clubhouse entrance, Circle Drive. And then whenever the new care center opens and we can move all of the residents to the new fantastic building, then we'll tear down the current care center there in Chesterfield, and there'll be a nice parking lot and a new chapel, we hope, by the time next spring rolls around. And we can get all of that moving there in Chesterfield, and that campus is going to be unbelievably nice when everything's finished. But we're getting there one building at a time, and you're able to see that and experience the new clubhouse building there in Chesterfield now. If you're wondering why my background has just changed instantly, it's because the camera battery died and I had to plug it into the wall and change directions that I'm facing the camera. So what I was about to say is that's about all I have for you this week. I hope that this video finds you in good health and good spirits. Again, expressing your appreciation to the staff who works so hard and takes the risk to come take care of you every day would be greatly appreciated. They don't say that much, but I'll say it for them, that the staff really loves what they do. They love to take care of you. They love to come to work every day. This is a great place to be, and we're very excited about it. Even during the entire COVID-19 episode and pandemic, which is not over, we've not had to lay any employees off or let anybody go. We've been able to keep everybody busy because their mission is to take care of you as best they can. I hope that you are able to fill out the resident satisfaction survey when it comes next week or the end of this week, and are able to honestly report that your satisfaction is high here at Friendship Village, but be honest about it. And we look forward to those results and doing what we can to continue to improve the services that we provide to you. Next week for Sunset Hills, we will be able to come to you live from the ballroom with a simulated all-resident meeting from the ballroom. Chesterfield will probably do a video with Carmen Franzak explaining what's going on and giving you an update for the Chesterfield campus. But in the meantime, I'm happy to see you. I hope you have a great day and a great weekend until the next time we talk. Thanks. Good to see you. Bye.